When I first contemplated healthcare administration as a career, in fact, I did it on the encouragement of a predecessor here at Floyd, 2 CEOs ago. He said to me when I was a young man, "Hey, Kurt, I think you would make a good hospital administrator." And I said, "Well, gee, what do hospital administrators do?"
Kurt is the type of leader that you feel very at ease with. You kind of feel like Kurt is just that guy next door.
I've always found him to be a man of great integrity with a strong work ethic.
Sometimes he reminds me of Johnny Carson. He kind of has that vein about him, and there's a little something in his delivery.
Well, I think you always got to have fun. I mean, shoot.
He has great judgment and wisdom, which work out very well for a hospital CEO.
It's one of my key objectives every day. I want to find something that's fun to do.
Once I was sharing with Kurt that I was taking swimming lessons because I'm a bad swimmer. Well, he told me that when he was at Emory, there was a class called drown proofing. As I heard the story, I kind of said, that's ridiculous, and I'm glad it wasn't there when I got there. But I thought about Kurt's leadership, and I said, I think he's taking it out of the pool, and he's using those same skills in his professional life. And so if Kurt were to teach a class called drown proofing for healthcare executives, I just might sign up for it.
Kurt had been here for approximately 15 years when he assumed the leadership role. And at that time, the hospital, Floyd Medical Center, financially was struggling.
Well, early in my tenure here as CEO, the marketing folks came to me and said, "We need to do an image campaign." And I responded that there are things that we need to do to improve our culture and our patient satisfaction. Then we can do an imaging campaign.
As you look around now and see this facility, this all comes from those decisions that Kurt made 25 years ago.
Every day we'll have a couple of hundred folks show up in our emergency room, 40 or 50 people having surgery, 200 to 300 patients we're taking care of in the hospital. All individuals that come to us not because they want to, but because they're sick and because they're hurt. And we need to create the kind of environment that's warm and inviting and where we're meeting and greeting people appropriately. We decided to pursue Lean and Six Sigma. And then we also implemented GE's 100-day workout methodology, although we changed it to 120 days. And so we get together at a kickoff, 30, 60, 90, or the 120-day period to check in to see how we're doing on the projects that we have adopted as an organization. And one of our mantras or sayings is that if quality is the goal, then financial performance will be the exhaust.
That's one thing Kurt's so good at, is getting feedback from the community. He reached out to mothers and said, what can we do to improve your time at the hospital with the birth of your child? The NICU unit is truly a blessing because it's the only one in this area. Growth in the emergency department has been tremendous. We have the helipad now with our level of trauma service.
South of us, there's a critical access hospital that we were able to build about 10 years ago. We have a hospital to the west of us in Alabama that we took over. And then to the north of us, there's no hospital at all in Chattooga County. And 3 or 4 years ago, we decided to see about putting in a freestanding emergency department, which we did. And as they say, in that movie Field of Dreams, if you build it, they will come. Boy, that really happened. One of the things I've learned about rural health care is that each situation is unique, and you've got to understand the factors in each rural community and try to bring some creativity. Involve the frontline coworkers whenever you have an issue. They know what the issues are. You should ask them. Also engage them in helping to solve the problems.
Vision, empathy, caring, access for people that do not have it, improving health care, saving lives. All of those are colors and features of the rainbow of that arc that would paint the full picture of Kurt Stuenkel and what he's meant to this institution.
It's a great privilege for me to be in this role and to wake up every day to try to think about how we can continue to make things better. One of the things I wanted out of a career was to not be bored and to do something meaningful. And I think I can check both those boxes.